Okay, we're back. We're live here on Martin Luther King Day. ThinkTech works every day, every weekday, from noon to 5. That's 5 shows, 5 talk shows every weekday for 25. I can do the math on that. And joining us today, not necessarily for the math, well, partly for the math, Executive Director, Executive Director of the Hawaii Connector, Jeff Kissel. I'll get through this. And the Deputy Executive Director, Eric Alborg. Thank you for joining us, you guys.
Thanks for having
us. Yeah, great. So we're here to sort of get an update from you about what's going on. You took office in October, Jeff, wasn't it?
October the 7th, just a little over 90 days ago.
Yeah, wow, exciting.
And as Walter Winchell used to say, there's good news tonight.
Okay, we're going to call this a look at the connector, and you'll see a business. We want to explore not only what's happened since October 7th, we want to see how you have seen things maybe that you didn't see at first, and how it is revealed to you that this could be, should be, is being a business, and a business will be better than just a straight government approach, because a business can be made into something sustainable. You know? So give us a status report, Jeff Kissel, about what's happened in the last 90 days.
The last 90 days, we have worked to bring access to health care to now over 16,000 clients that are enrolled in insurance programs through the connector. We've also expanded the scope of the connector so that we've helped more than 50,000 people get access to state Medicaid that is now almost fully funded by the federal government. So if you look at this, we're approaching 65 to 70,000 individuals who just a year ago had very limited coverage options, and now they have full access to Hawaii's excellent healthcare and wellness system. That's really the important part of our mission, and we're pleased to have kind of pulled things together over the last 3 or 4 months to make that happen. Eric is an integral part of this team. He's been the interface between us and the federal government, and he's been a representative to our partners in the state government now for almost 3 years. And it's a culmination of a lot of people's hard work, not just me walking in and taking the credit.
Let me go back for a minute to the connector idea, the idea of a connector. This is something that was created right by Obamacare and by the Affordable Care Act. And it is an instrumentality that is supposed to connect people who can't otherwise get medical insurance with insurance carriers that can provide medical insurance for their situations, right?
That's right. It's a state-based exchange. They call them SBEs in the government parlance.
In the federal government. This is all made possible, that may be the wrong term, but this is all created by the Affordable Care Act.
This is all entitled under the Affordable Care Act. The states that actually adopted their own exchanges, Eric, how many have got their own exchange programs of one form or another?
There's about 16 of them today.
16.
They actually have the benefit of infrastructure that the federal government has bought and paid for, so that the people in those communities can access local insurance company, local resources through the community in a way that they can make choices and they can get assistance in paying the premiums and the cost of insurance. The federal government then offers the same program with much more limited functionality to a whole host of other states. Roughly how many are those, Eric?
About 34 other states are run by the federal program.
I don't understand. Is this voluntary by state? I have a recollection that some states don't want it, say no to it, and thus deprive their citizens of the opportunity, which I don't understand.
Yeah, that's right. Some states started out with a state-based marketplace. They might have experienced some challenges, but the Hawaii Health Connector has continued to be providing this service since October of 2013.
Which is early in the game.
Yeah.
It's just when it could happen,
yeah,
we did it. Hawaii is good like that.
They are
got on board
good.
right away.
For an example, the state of Texas opted out. And there's kind of a hue and cry in the state of Texas because they're not getting the benefit of the kinds of coverage options and the federal subsidies that states like Hawaii are getting. Easy example. For every 10,000 people that have access to health care, the community, not necessarily the state, but the community saves almost $40 million in unreimbursed medical costs every single year. Now, that's a huge chunk of money, because those costs previously were incurred by you and I when we had to go and buy medical services from the hospitals that had emergency rooms where people weren't paying for the cost of medicine.
We pick up the slack that way.
We certainly do, and it's in the price of everything we pay for in the medical services industry.
So this actually helps the other guy too.
It helps.
It helps the ordinary citizen who has got regular insurance, if you will, doesn't use the connect, doesn't have to use the connector. His medical costs are diminished by the fact that the connector is connecting people.
That's exactly right. It's beginning, and the evidence is starting to show up, and it's pretty clear. It's beginning to bend that cost curve down and moderate the medical inflation that has been rampant in the economy.
Oh, yeah.
So it benefits us all, regardless of whether we buy the coverage through the connector or not. It also merges the benefits of the Hawaii Prepaid Health Care Act very nicely with the Affordable Care Act, so that people, for an example, on COBRA, who have employer-provided plans under the Hawaii Prepaid Health Care Act, when they lose their jobs, they have a big COBRA premium to pay. Well, they qualify for premium assistance, generally speaking, because they're no longer employed, their incomes have declined. So instead of paying $600 to $1,500 a month COBRA payments, people who are going to get their insurance through us can reduce their cost to maybe $150 to $200 a month. Now, that's food on the table and rent and mortgage payments for real families in Hawaii.
So is the connector offering, these products to people who can't get these products elsewhere? Is this for people who are having trouble in the marketplace?
This is for people who have really two conditions. The first is they want to see all the options in the marketplace, because that's what an exchange is all about. You log on to your brokerage house and you want to look at the New York Stock Exchange, you can see thousands of opportunities.
It's a marketplace.
And you see exactly the same thing your neighbor sees. So it's fair pricing. Then the other thing is, because the federal government has offered both the states and the individuals, along with their businesses, premium assistance and tax breaks, the benefits to you personally could be very, very substantial. It could mean the difference between affording school supplies for your children, that extra vacation, making the car payment, and not.
So if I go through the connector and I get connected to, a company, a private insurance company and a product, there's a government subsidy there, a federal government subsidy that helps me pay that premium?
Correct. One of the reasons that our technology is such a challenge and our computer systems are so complicated is because we have to be talking to the federal government and every private insurance company that offers coverage on our exchange all at the same time, so that we can help you understand what your options are and you can make an intelligent choice.
That's not to digress too far, but these are the times we live in. No surprise that the Affordable Health Care would be, 3,000 pages of legislation. Maybe that's low, I don't know. No surprise that it would be complicated. No surprise that it would require a lot of people to work with each other and throw a lot of information at each other, and each one of them has to digest and interpret that information. It's like this is the world of the 21st century. And the way we deal with that is with computers, which, sometimes that's easy and sometimes it's not, but it's always better tomorrow than it is today, or better today than it was yesterday. So this is all a computer play, isn't it?
Well, that was the mistake, unfortunately, that everybody made when they went into this. They thought they could flip the switch, the computer would go on, and everybody would know what to do. Well, that's far from the case. How many people today employ outside financial coaches and advisors to help them make their decisions with their IRAs and their 401ks? Companies provide those resources for their people. Well, health insurance is even more complicated. And so what we at the Connector did, thanks to Eric and his team, is we put our people in front of the technology so we could help people navigate through the process. We could coach them and help them make intelligent decisions. These are life-changing decisions. If you buy the wrong insurance, it could cost you a lot of money and you can't change for a year.
Yeah, that's kind of tough, isn't it? I mean, if you were in charge of the whole national operation, wouldn't you make it easier to change?
If I were in charge of the national operation, I would do what Richard Nixon and Teddy Kennedy failed to agree on, and that's adopt a national law very much like the Hawaii Prepaid Health Care Act back in the early 70s.
Touche. That would, we really had, without all this, we had a great statute, seemed to be working for us. And I guess there are still people out there that say, do we really need any of this business? Why can't we just go back to the way it was? It seemed to be working fine, and it was cheaper for a lot of businesses anyway. Do you hear that? You must hear that once in a while.
Well, I hear that argument all the time, and I can say now from personal experience that the merging of these two acts, the coordination and harmonizing of the Affordable Care Act, which is the law of the land until somebody changes it, with the Prepaid Health Care Act, puts the Prepaid Health Care Act on steroids. It absolutely enhances the benefits. The one example I just gave you, people on COBRA under the Prepaid Health Care Act had to pay for the companies previously employed very, very expensive insurance without any subsidy. Now they not only get a subsidy, but they have the opportunity to choose from more affordable plans that may better fit their circumstances until they regain employment.
What plans are these? Are these plans like, I don't know, like Kaiser? Are they plans like HMSA? Or are they plans that are designed and developed elsewhere on the mainland? What are we talking about?
They are. They're plans offered by commercial carriers. What's really unique about these plans is that they're sort of standardized coverage to make sure that individuals have at least coverage in 10 essential areas. They call them the essential health benefits. And what that means is that if you're, a musician playing in Waikiki and you don't have access to employer-sponsored coverage, you can come to the connector and get a quality, affordable health plan through the connector.
Does that mean it's going to be cheaper than with the employer? I mean, say HMSA or Kaiser, for example, the classical models that we've had for years. If I go to the connector, is the check I write going to be less? Could it be less?
Yes, absolutely. If you qualify for premium assistance.
And that's a question of how much money I make
That's
and
a question. You can
my
make up to
income
400%
situation.
of the federal poverty level and still get premium assistance. It's not, you don't have to be impoverished for that. If you qualify for it, the federal government makes part of your payment. So your monthly payment is actually lower each and every month. You don't have to wait for a refund at the end of the year.
Is it lower than it would be with HMSA or Kaiser?
Yes, if you bought directly from HMSA, there's a premium amount, let's just call it $500 a month. And if you walk in as an individual and you pay that $500 a month premium, then there's no possibility of getting a subsidy. If you buy that exact same plan, which is priced at $500 a month, it pays the exact same benefits, exact same copays and deductibles, and you qualify for premium assistance, you will pay less. And that's a benefit to HMSA and Kaiser as well. Wouldn't it be wonderful if every business could have a big chunk of their customers get subsidies so that they can buy more of their product from them?
Well, if I'm on HMSA or Kaiser right now, does it pay, under my employer? Or, even in a really small employment situation, does it pay for me to come down and see you? Does it pay for me to check my options through the connector? Maybe I do better?
It always does. Eric will explain why.
Yeah, you can always compare your health insurance between coverage that you either get your employer or outside the marketplace or through the connector. In many cases, as Jeff was just referring to, there's tax credits, or if you have a small business, you can get a small business tax credit, which can subsidize up to 50% of your employees' costs. So in either way, you'd want to sort of compare both of those products to see which one would be more financially advantageous for you.
Now, you mentioned before that, that you put a person, a human being person, that kind, between the computer and your client, so to speak. And so if I came to see you and asked you about this, there'd be a person to talk to me.
Absolutely.
I wouldn't be relegated to a website somewhere.
Well, it's extraordinarily complicated to figure out what health coverage might be the best for you. So we have an entire program called the HEAT-YOLO program. It means of wellness. And individuals can sit down with you and help you navigate through all of the choices of health plans that might be available to you.
Yeah? So if I called you today and said I want to come down,
Absolutely.
when do I get in?
We could come to your house. We can
Oh, wow.
sit down with you at a place that works for both you and us, or you can come to our offices
Okay.
any day of the week.
All right, we're going to get more into the substance of this and the challenges of it right after this break. That's Jeff Kissel, Executive Director of the Hawaii Health Connector, and Eric Alborg, the Deputy Executive Director of the Hawaii Health Connector. We're talking about a look at the connector, and you'll see a business. This is very important going forward here on Community Matters in the ThinkTech TV series. Why don't we ThinkTech? The ThinkTech live stream series on Mondays. We'll be right back.
Hi, I'm your host on ThinkTech Asia, Bill Sharp. I look forward to you joining us each Monday between 4 and 5 o'clock when we film right here in our studio in downtown Honolulu. The show, ThinkTech Asia, focuses on contemporary events in Asia. And by Asia, we mean anything from Hawaii, south to Australia and New Zealand, west to Pakistan, and as far north as the Russian Far East. Clearly, this is one of the most economically dynamic centers of the world, and we bring you up to date on what's going on in a whole host of countries in this very vital region. We look forward to seeing you. Aloha.
Okay, we're back. We're live. We're here on Community Matters with ThinkTech, and we have Jeff Kissel, the Executive Director of the Hawaii Health Connector, and Eric Alborg, his deputy. And we're taking a look at the Hawaii Health Connector, and we're seeing that essentially it's appeared as could be a business. What do you mean by that, Jeff?
This is a real business. This is a self-sustaining business. Once we grow, and we have to do that, to ensure somewhere around 60 to 70,000 lives. And we can do that, and I'm confident we can do that. This business will actually throw off a surplus that can be either returned to our clients in the insurance industry, or it can be invested in developing this resource that we've got in Hawaii. This was paid for by the United States government into a larger and even more functional resource. It's already generating a big return for the economy in covering the unreimbursed costs that formerly the emergency rooms paid for and passed on to you and me, and the doctors and pharmacies paid for and passed on to you and me. So we get our fees basically as a percentage of the premium. Next year we'll get about 3.5% of the premium as a fee.
Was that
for
set up
services.
in Obamacare that way?
That's in the statute. That the states can select a number of different options, and we've patterned ourselves after the federal exchange, which does exactly that.
Okay.
And we need about that much money from about 50 to 70,000 individuals in order to start to throw off a surplus. We're well on our way to achieving that goal. But in doing that, over the next 10 years, we will bring in more than $500 million in direct federal subsidies to this economy. Those are tax payments to Hawaii taxpayers being spent in this economy. And when you consider the wind down and the demanning of the Department of Defense, that's going to be an important chunk of money to come into this economy.
Yeah, and that comes in the support of the premiums for health insurance. That's the way it comes in.
It does indeed.
And then depending on the premiums, the total premium, you get 3.5%?
About 3.5%. More importantly, though, in the expanded Medicaid,
yeah,
we save even more hundreds of millions of dollars because Eric, for how long is that going to extend?
It goes through 2017, and then it continues to be a significant chunk, up to 90% of the cost for Medicaid costs will be paid for by the federal government.
And that's because we have a Hawaii state-based exchange, because the connector is here.
That's the federal government's way of rewarding you for having accepted the deal.
In. Exactly right.
Opting in.
So this is a very sound business proposition. We filed on December 31st our report to the state legislature. It's a couple of hundred pages of data, but the message is clear. This is not a handout. This is an economic stimulus for the state of Hawaii, for the people of Hawaii, and it'll lead not only to direct stimulus in dollars, it'll lead to people being more productive because they're healthier, they can live longer, and regrettably for all of us, we can work harder.
Yeah, yeah. Well, I mean, it sounds terrific, and it also sounds great that you can take this federal formula and make it sustainable as a business. So the idea is to have the connector get that floor of clientele, of income, of revenue from the premiums. That's you got to achieve that.
We have to build our clientele up. We're going to need about $28 million in operating capital
run the operation.
launch this business
Yeah.
to the point of sustainability.
Yeah.
We think it'll take 5 or 6 years for
Yeah.
that process to work through.
What happens until then? Somebody fund you?
We are asking the state of Hawaii to help support us. The federal government, if they see that there is consensus here in our community, will reach out and they will provide some assistance, but they've already spent a little over $100 million building the infrastructure.
Just in Hawaii on this connector.
On this connector. Now that's the software, the hardware, and training the people and reaching out into the community with outreach programs. So if you look at all that, it's a pretty robust package they've given us, because we're getting back more than $30 million each and every year starting this year as we take people off of the public roles for
put them on
unreimbursed
connector
services
program,
and transfer them to the insurance industry. That doesn't count the value of the wellness care and
Yeah.
the health care that people get.
Yeah, okay, so that means, though, you've got to market. You've got to get out there, you got to tell them exactly how this works and allay their concerns and make them sign up and use your benefits. That it's all critical to that. If you can't bring in enough business, you won't be a sustainable business yourself.
It's exactly right, and people like you are helping us. We deeply appreciate that, because in helping us, I think you're helping the community a great deal.
Well, we think this is a good idea. We think Obama's a good idea in general. So, but let's go to the dark side, as it were. I mean, there are always people taking pot shots, and we should talk about that at least a little bit. For example, there must be people out there saying, if you're bringing more people into health care coverage in the state of Hawaii who didn't have coverage before, then you're making it harder for the existing clientele, the conventional insurance people, to get access to medical care. And therefore, instead of taking a week to see a doctor, for the average guy, it takes 3 weeks or whatever. And instead of having a test in 1 week, it's a test in a month and whatever. So I'm wondering if you're getting that kind of complaint and whether it's real.
Well, I think during a period of implementation, the system is going to have to adjust. Nationwide, Hawaii is no exception. Fortunately, Hawaii has a terrific system that guarantees easy access to medical care. It is easier to get an appointment, to get in to see somebody here than almost any community of this size anywhere in the country. And it's because the medical community, supported by the fine insurers here, Kaiser, HMSA, and the other participants in this cost system, have really worked to build this medical establishment. Queens, Hawaii Pacific, and the other medical providers, the urgent care centers all over now, give great access. And what we're doing by creating steady demand, I believe, is going to reduce costs, because there will be fewer critical cases, which really soak up the resources and the time, because we can handle more of the routine cases. And the numbers are beginning to show that. It's only a couple of years into the program, but I think that the numbers will demonstrate that conclusively if this program continues on.
Yeah, if the community works together on wellness, And then I suppose if you have the whole sort of data approach under control, and as a demographic who's going to need what when, then you can be more efficient in having the resources necessary to respond to that demand.
That's exactly right. Now, there are national providers that want to come into the Hawaii market. They can't come in as insurers for a couple of years yet, but they're talking about 50 state insurers in the Medicare business, which is not part of the Health Connector. Humana and a couple of others are already offering coverage here. And so I think we'll have access to a lot more choices in the near future than we've had in the past. And I think competition is good and it's healthy. Some of the people who would prefer that we go away are a little bit concerned about competition. Kaiser, for an example, has embraced competition nationwide, and they're doing a heck of a job supporting the Affordable Care Act and the exchanges all over the country.
Now, does Kaiser and HMSA sort of bid through the connector approach? I mean, and who are the carriers that actually come in and make product and offer products that would meet your specifications for the connector?
Eric?
I mean, are they Hawaii companies? Are they out of some place in the mainland? Are they out of Bolivia?
Well, right now we have two major health insurers. That's HMSA and Kaiser. And then, of course, we have a number of carriers.
Do they bid in the connector?
Yes, they bid on the connector. Their products go through a process through the insurance division and are looked at by us to make sure they're the quality products that I was referring to.
Is it a low-end product relative? You know, I know that, you know, you can get one like this, you get one like that. You can have, you know, certain doctors in a pool, larger pool, smaller pool. You can get certain coverage. I mean, it's not as simple as eyeglasses and dental or anything, but, you know, certain kinds of things you can get, other kinds of things you can. Is this the same as what I would get in my job with my employer?
The same or better, probably,
Really?
actually. Yeah, the two ways to look at health insurance is usually to look at the benefit structure. I was talking about the 10 essential health benefits to make sure that you can get care here, or if you're visiting family on the mainland by chance, you can still see a doctor or go to a hospital if you need something. That benefit structure is really important. And then the other part that comes into play is the cost sharing. And that really gives you the different types of products that you were talking about. A lower end product where you might have to pay more out of cost, and that's calculated based on an AV or an actuarial value.
Like a deductible kind of thing.
It's like a deductible. You'd have to pay more if you got, say, a bronze plan, which is a lower end plan.
But I'd sooner have the insurance than not, so and I don't have the money for the next step up, so I'll take the lower premium, the higher deductible, and somehow, since I'm 22 years old and very healthy, this will be fine for me, kind of.
And that's a personal choice. But if you're 22, you should have health insurance no matter what.
Oh, sure.
It's
Anything
just
can happen any day.
anything.
Yeah.
And if you do have a health condition, or you do have other reasons that lead you to want to get a higher end product, you can get a platinum plan, which pays up to 90% of your health costs. So there's the whole range of products.
Aren't you worried that when people hear this, they're gonna run down to your office and swamp you? I mean, they're gonna be there with lines around the block trying to find out if they can cut a better deal for you guys?
Well, we'll sign them up as fast as they come in.
Well, that's the thing. You want to sign them up.
That's right. Now,
you're motivated to signing them up.
Exactly. Open enrollment ends February 15th. So if you want insurance for calendar year 2015, you must sign up with us by February 15th. If you don't, then the only way you can get on the connector is through a business, or if your circumstances change. You get married, you have a child, you lose your job, things like that.
So that's a reason to get married. If you missed the February 15th deadline, run out and get married. Have a child quickly. Adopt the child already. It's okay.
You can do that, but don't quit your job. That's too expensive. Everything else consider.
Well, that's pretty hard, I mean, is there a good reason for that, administratively?
Well, I think there are two reasons. It was a political compromise, which is, of course, the main
always
reason.
Hard.
But the other thing is they don't want people who get sick, sign up for insurance, and then drop out the next month.
Sure.
So they want people in the system, and they have, in order to remove the terrible feature that the American insurance programs had, which was, we will not insure you for pre-existing conditions. Some concessions needed to be made to the insurance companies, and that was one of them.
The February 15th.
The limited enrollment period. It's just like Medicare. You only have a little window for Medicare to change your plans once you're in the system.
Yeah.
Same thing.
But the trade-off is that I can come in with a pre-existing ailment, right? As long as I sign up in time.
You can if you are injured during open enrollment, you can sign up in the emergency room.
Oh,
literally.
Goodness, this is really a bonanza,
So
a machaya, as we used to say.
That's exactly right. I speak a little French too. But that's absolutely true. You can if you're diagnosed. I don't envy anybody in these circumstances. You don't have insurance, you're diagnosed with a difficult disease, you're injured. You sign up during open enrollment, you got the coverage. And that coverage lasts as long as you pay the premium.
What's the period? We know it ends February 15th. When does it start?
We started November 15th. Next year, when is open
We
enrollment?
start October 1 and we end in the middle of December.
Okay, so the no man's land is between February 15th and October 1.
That's right.
Yeah. Okay, we're going to go into a no man's land tour for a minute. We're going to have a break. That's Jeff Kissel, Executive Director of the Hawaii Health Connector, and his deputy, Eric Alborg. We're here on Community Matters, and we're looking at the Connector. We're looking at the Connector. And what we're seeing is, at least in the future, we're seeing the evolution of a business that is self-sustaining, which is really important. We'll be right back.
Aloha, I'm Hunter Hevlin, host of Sustainable Hawaii here at ThinkTech Hawaii. You can tune in every week on Thursday at 2 p.m. to see interviews with sustainability professionals from around the state and even further abroad, learning about activities with water management, food security, waste management, and a whole host of other fascinating opportunities to get engaged with making a greener island. So if you're interested in making the transition from consuming individuals to communities of producers, check us out every Thursday.
Okay, we're back. We're live. You know, we have a few minutes left to sort of see what else is out there that you need to know about this. I guess one thing, I'd like to pursue the notion of making it into a sustainable business. You mentioned, you know, before we started, that the number of employees that you have at the Health Connector has diminished since you started as executive director. And this you know, sounds like a regular executive, a business executive taking charge, making sure that things work efficiently. So how does that process work? Because this, essentially, it's a government agency, isn't it?
No, we're actually an independent nonprofit corporation with a separate board of directors.
So I can go down at DCCA and see that you are a nonprofit corporation right now here in Hawaii.
You can do that. We also post our board meetings every month on the Lieutenant Governor's website. You can come and attend. They are open to the public.
Okay. You don't have the Sunshine Law, though.
We are voluntarily observing most of the provisions of the Sunshine Law.
That is very nice of you.
So,
really.
and we believe that this is the public's money. The public needs to know how it is being
Good
spent.
move.
And
Yeah.
we have a lot of public oversight. What's really important, however, is that because we feel that we are a sustainable business, we want everybody to understand our business model. That's why we took the trouble to construct this lengthy report to the state legislature and detail it out. Now, some people will use certain facts in it to put forward alternate points of view. Fair enough. Our obligation is to bring the information to the people and let public debate and discourse help decide the future of this important piece of infrastructure in our community. We are not here to influence the public debate except to the extent of doing the absolute best job we possibly can to operate the business in a sustainable way.
It strikes me, I think I'm right about this, is that if you look at the prepaid statute that was in existence from around statehood or so, or a long time ago, and then you look at the intersection between that existing system and Obamacare, this Health Connector is it. You are the connection. You are Obamacare. You are the expression of Obamacare in our state. Am I right?
This extends prepaid to every person who is a legal resident of the state of Hawaii. Everyone. It doesn't exclude anyone. And, you know, and these are real people. These are not statistics. I've heard well-intentioned people say, well, we cover everybody but 100,000 people. Would you like to be one of the 100,000 people that's left out when we don't have to be? Jay, I think I've said this before publicly. I'll say it again because I'm proud of it. We spend millions of dollars and we're glued to our sets when there are people at sea being rescued, hikers in the mountains being rescued, miners deep underground being rescued. Millions and millions of dollars for those people, and we should. Now we have the opportunity for considerably less money to bring that same rescue to the single mom who's working 2 jobs in the hospitality industry, you know, perhaps making up rooms during the day and being a hostess at a restaurant at night, so that single mom can afford care for her kids and herself, so she can be diagnosed with early onset diabetes, heart disease, and the other things, and she can live a normal life for her children, for the dad who can get colon screenings on a regular basis so that he can continue as a viable member of the workforce, even though he might be working as a bartender in one job and a custodian in another, and not qualify under Hawaii prepaid. These are real people, not just 100,000 as a statistic.
Yeah, so you catapult somebody who is in the lower economic group into middle class by way, because this is the single most significant indicia of middle class, I suppose, to have this kind of benefit.
Not only that, but we bring that access to health care to the children, to the whole family. So the students, when they start to show symptoms, they can go to the doctor, and for a $10, or if they're going to Kaiser, a very nominal copay, $5, get diagnosed, get treatment, so that the cold doesn't turn into bronchitis, turn into pneumonia. It's really important stuff. And the parents don't have to take off of work, and the kids can continue in school.
So the answer to my question then is that yes, this is the expression of Obamacare in our state.
It absolutely is.
This is the way it works. It happens through you guys.
That's right.
If I want to see Obamacare, I see you.
Come
You
to
are
us.
it. Yeah.
If
Okay,
you can't
so-
get to Kailua during the holidays, come see us.
Touche. Again. So how many potential clients do you have? I mean, what is the shape of your market that you're looking at bringing into the system?
There are 675,000 insured individuals in the state of Hawaii.
Right now.
Yes, conventionally insured individuals, approximately. Now, these exclude, for example, people on Medicare, people who are getting insurance through the military and things like that. Our market is approximately, and there's another 100,000 who are not insured. Our market is approximately 100 to 150,000 people potentially. We think that we can serve at least half and perhaps 2/3 of them, given enough time to bring everyone into the system. Plus the fact that the state is growing. People are coming here. We have a large non-US based student population. It's growing. Those students are eligible, if they are legal residents here, they are eligible for coverage.
What about their immigration status? Student
Student visa is a
Student
legal
visa,
resident.
okay.
Yeah. So, and many of those students can't use their national insurance outside of their home country. So they can benefit from it, they can qualify for it, and again, they don't place a burden on this community if they become ill or injured and they don't have the money to pay for it.
We want everyone to be covered because we know that's a better economy.
That's right.
And we know that takes the heat off people who otherwise have to share the burden of emergency room type medical care.
And people live, and they live quality lives.
It's a humane thing. It's a moral issue. That you're talking about.
Absolutely. If you can throw a rope without much effort to somebody who is falling off a cliff, you do it.
It's a rescue thing.
It's
And
exactly
you know
right.
what? Until Obamacare, I mean, correct me if I'm not current on this, but until Obamacare, we had this phenomenon of, I call it nickel and dime. There's a book by a woman named Rosenzweig, a New York Times reporter. She went to the South, and she got a lot of multiple little jobs, and she was down a spiral going down. I mean, economically. She was a reporter who divested herself. And, you worry about the whole country going that way. You worry about Hawaii going that way. This stops that. I mean, or this at least is a good way to resolve that in a relatively painless fashion.
If you're healthy, you can climb the ladder of success a lot easier than when you're not healthy.
Okay, final moments, last question. There are those, I expect, who would like to see the whole thing repealed. I mean, would like to see the connector terminated. I mean, is this true? And if the connector is terminated, I mean, who are they? Why? And if the connector is terminated, what happens?
Well-intentioned people make mistakes, and they make mistakes for moral reasons. Poorly intentioned people sometimes do what's in their best interest, and it's not so moral. I think there are well-intentioned people who do not believe the government should be as deeply involved in the medical services business as it is. And they deserve their day in public. There are other people whose businesses are built on a particular advantage. I'm not talking necessarily Hawaii, but everywhere in the country. And they are using the opportunity to throw out Obamacare or damage Obamacare to put their own business interests ahead of the welfare of the people. When you choose between your own money and somebody's extended and high quality life, I believe you've put yourself on a death panel and you're sitting in judgment and you're doing it for dollars. It's not a good thing.
We have to think of the common good because we are the common good. It
That's
affects
exactly
us just as much. Yeah. Well, I guess I'll come down and see you, Eric. You can consult with me.
I'd be happy to.
How many
Find
staff
some
do you
help.
have at the office over there?
We have about 25 total staff that are working day to day.
And where are
We
you?
have a whole number of additional staff on all the islands
Ah,
who will work through outreach programs and can help you. So there's about 50 or so of those people across all 4 islands. Excuse me, across all of our islands.
and where are you here in Honolulu?
We're here just down on Merchant Street, although you can meet with an in-person sister at any part of the island, whether
Okay.
you're on the Leeward or Windward or
You guys
downtown,
can come back
anywhere.
again and again then.
Come to
you're down the block.
HawaiiHealthConnector.com and you'll see a list of our outreach events. You'll see our 800 number, and you can call us anytime and we will be glad to assist.
That's wonderful. Jeff, you carry the lessons of a business executive to a quasi-business organization, and it works well.
Thank you, Jay. Thank you for having us.
Thank you, Jeff Kissel. Thank you, Eric Alborg.
Thank you.
This is Community Matters. We're looking at the connector, and we're seeing a business. Aloha.